All right, let's go over the conduction system. So the heart has an electrical wiring within itself and allows the impulse to be generated, and then this will cause a depolarization of the atria. It'll pause at an AV node. It will then continue down and cause the depolarization of the ventricles to allow the ventricles to empty and then force the blood forward and out to the circulatory system to the rest of the body. When we put on the EKG, we're trying to understand where this electrical flow is coming from. This is a pretty large science. Just to break this down, this is going to be just basic explanation of how we can read these impulses, these electrical impulses from the electrical conduction system of the heart using the basic EKG. Now, we're going to use 4 leads, but in this case, it's actually showing you just the initial 3 leads here. All right, so we know that electricity wants to flow in a right shoulder pattern down across the body to the left leg. As we see, this is sort of the way that electrical impulse wants to go down. It just happens this way. It starts here, it travels down, it pauses there, it continues on down, and this is where we would call that a vector. So it's basically going in that direction. The majority of all the energy and electrical impulse that's once generated in the SA node is following in this pattern. This casual pattern that goes from that right shoulder all the way down to the left leg is a standard lead called lead 2. Lead 2. Now from this, we know that we can see the electrical impulses, and since it's following in that degree, that pattern, and most electricity is flowing in that way, your EKG complex is going to be large and upright and mostly positive. We talked about the EKG yesterday, in that there should be a P wave, a PRI, a QRS, and then a T wave. And what I'm saying now is that if electricity is flowing in this direction, what would happen to the QRS complex? Because the electricity is so strong flowing in that direction, we would see mostly a positive deflection of the QRS complex above this baseline. So it would look more like this. Mostly upright, because that's the way the electricity is flowing. So lead 2, it goes across from this shoulder, and we're measuring it down on the left leg. Lead 1 goes across from shoulder to shoulder. So lead 1. Again, lead 2 is going from that shoulder all the way down to the left leg. And then here we have the opposite shoulder coming across, and this will give us lead 3. But it's basically going down this way. Because when we use a 3-lead configuration on the patient, the 3-lead configuration, we're placing a lead here, here, and somewhere down on the leg here. So here is lead 1, here is lead 2, and here's lead 3.